Gloves on.
All right, thank you everyone for coming back. It's Monday afternoon, and we're back for week 12 of the Brick Wall series. Is episode 55 with Dr. Irina Logman. How are you today?
Hi, so nice to be with you guys.
Yeah, thank you for joining me. Where are you joining us from?
Actually, from my home, right on Wall Street. This is my apartment. I am off on Mondays, and I'm all yours today.
Well, I appreciate that, and I'm happy that we could work it out, that it was your day off, and I'm sorry to bring you into the work world on your day off. But so you run Advanced Holistic Centers. Why don't you tell us a little bit about that and how it started?
Of course, the Advanced Holistic Center started about 16 years ago when I finished my acupuncture school, and I thought it would be a great idea to combine East and West because I come from a family of a physician. My mom was a doctor, my sister is a surgeon, and they are amazing doctors. And I always saw the medicine and the patient and the disease and things that were worked on but never really resolved itself. And somehow the alternative medicine kept calling me, and the articles came up and people came up to me with these ideas. So after I went through the acupuncture school, I thought, why not do this? And it did take me a long time, at least 10 years, to get to a place where we were actually a center with employees and different services. And for the past 5 years, it's been absolutely amazing because it looks like people's consciousness and minds are opening up. Everybody's welcoming alternative medicine. People are aware how limited Western medicine is and how much we can be a synergistic aid and help get them along into the total well-being where you have the mind and the body and everything is even and balanced. So it's been a long road, but as of today, I'm pretty happy as how my business came up about and what's happening in the world with alternative medicine.
So you were ahead of it and a trendsetter, and you were ahead of the game, but you're saying that as other folks bought into it and media started covering it further, that helped with customer or patient buy-in to your practice.
Of course, and I almost feel lucky that this is the time when I became a practitioner, because let's say 20 years ago acupuncture was around, 40 years ago acupuncture was around. It's 4,000 years old. Chinese medicine, it's one of the earliest medical styles that was around, was documented, and people have been practicing it, and it survived all these years because it's effective. When I was a child, my pediatrician back in Soviet Union in Ukraine was doing acupuncture, and she was doing cupping. So it's been around. The fact that in the United States it came to this place at this time, I feel lucky and almost privileged to be able to do these things. I chose this profession without any idea of where it's going to take me. It's not, it's not a business you go in to make business. It's just, okay, let's see what I can do with that. And most definitely it's been an amazing, life-changing experience for me. And also I think for a lot of people who are my patients and who are my associates and employees.
So you just said something interesting. You said that you don't get into, alternative medicine as a business because, you want to approach it from an altruistic point of view or that kind of thing. But I've known you for a couple of years now, and you're a kick-ass businesswoman, with many locations around the city and, and beautiful, and not only, many locations, but also beautiful locations. Like clearly you're doing something right with that. When did that switch from altruistic to, I don't think you lose the, like, I want to heal people and that natural, feeling, but, when did you realize, like, oh, this is like a real business and I gotta, start getting serious about it, like on that end?
It's a very interesting question. I wonder how deep do you want to go, but I think working ethics, being willing to be there for the patients all time, because we sign up for this job, right? I'm not going to turn around and run away if things gets difficult. Like I would love to go and treat COVID as well. I'm not just going to say, okay, everybody's getting sick, I'm hiding. So I signed up for the job, number one. Number two, I was getting busier and I had to get help. And I hired one assistant and then another assistant, and they were students from school. And as they went through school and graduated, they became licensed professionals. And I felt, wow, this is amazing. They can actually work right beside me. And they were really talented. I was really feeling grateful for the light, for the consciousness to give me these wonderful people who were able to help me build the practice the way it is right now. And I swear, when I opened the bank account and I saw money in it, I'm like, oh my God, this is great. Never went for a business idea, only went for the delivering services, for giving a great product to people. I never sell anything that doesn't work. It didn't work for me. I don't sell anything in my practice. If I believe in acupuncture as a craft, you're going to get a real load of my enthusiasm because I've experienced it and I've seen people get better with it. Same with Chinese herbs. Everything else, I've tried it, some improvement, but not enough for me to sign my name next to it. So how did I become a businesswoman? Every time people call me this name, it's like, me? Me? I maybe had one class. I read books. I listen a lot to lectures, and honestly, mostly on spirituality and doing things for the right purpose. And it keeps taking me there, and I keep going higher and higher. So I guess I am a businesswoman, and I thank you very much. I feel I'm blushing, but I like everything nice and high quality. And I think if you give high quality, it attracts high quality back at you and for you.
That's a fantastic answer. And I've definitely read a bunch about, people focusing, and even within, the Jewish religion, which I, openly talk about how I'm a religious Jew, focusing on focusing on, on, spirituality and, not paying as much attention to materialism and getting wrapped up into that usually leads to more success in the materialism, because you're not trying to control every little instance. Where does that come from? More Eastern medicine and ideology, or Jewish upbringing as well, or where does that come from?
Honestly, Jewish, and not even upbringing, because I discovered it recently. I came from Soviet Union, completely secular family, and it's hard. It's just very hard to not have consciousness, to not have spirituality. Life just keeps giving you lessons, and there are no answers. The answers come when you start investigating, looking for more. But I was also learning a non-invasive modalities, more like an esoteric type of energy work, polarity, elements, craniosacral. I like to take classes of all sorts, and I saw something else in there that you don't see. With acupuncture, it's an actual needle that penetrates your skin. It's invasive, if you will. And it's documented. You can measure the changes in the hormonal levels and neurotransmitters. When it comes to energy work, you don't, but some people feel it. I felt it. So to me, it was life opening. Oh my goodness, there's more to life for real. If you sit and meditate and all of a sudden you feel tingling, and you start getting different level of ideas, it opens you up to different level. And I think sustenance, which is financial sustenance as well, it's also everywhere. It's energy. So if you put out that wonderful energy and you believe in a higher reason for it all, it comes. It came to me. I'm more than willing to share. So partially Judaism and a little bit of other modalities that are Eastern medicine as well.
So it's a confluence of your two passions that bringing it together. That's fascinating. And I did.
Let me just add. I apologize for breaking.
No.
My undergraduate degree is in health and wellness, but in medical lab sciences. So I come from a scientific background. I love science. So it's not just like woo-woo stuff. I stand by biomedical stuff. I love pharmaceutical stuff. I'm not just this one way of alternative medicine. I love science, but I think science has a long way to go, and we get there maybe another 300 years. So, yeah.
So, tell me about, at Advanced Holistic Centers, what, you mentioned some of them already, and, some of your interests, but what are the service offerings that you all have there?
So we started primarily with just Chinese medicine, which in itself is huge. Acupuncture is the main modality, and I think it's the most efficient and effective, which is needling, penetrating the skin into a specific area and causing a signal, and then the response comes in. But it also involves Chinese herbs. And you can go to the store and pick something from a shelf, and it's wonderful. But the question is this great for you? So when you come to an herbalist like myself or my associates, we do the evaluation and we figure out which combination of herbs will be appropriate for that patient, and for that particular time, because people change, people are complex. We figure out the patterns and hand select each herb to create a formula specific for you. So Chinese medicine is acupuncture, Chinese herbs. Other modalities like cupping are super popular now. Also very, very easy to do. And I have some tutorials on my Instagram. When you're home, you can definitely do this stuff yourself. Great for upper respiratory stuff, great for musculoskeletal issues as well. Athletes are always doing it. That I think Michael Phelps was like the biggest one who brought it out into public. Gua sha, which is like a scraping technique, and chiropractors call it grafting. It evens out the fascia. Mark Sebastian, warming technique, especially for people who have internal coldness. And we can discuss yin and yang theory if you'd like. And lately, of course, the nutrition and exercise, which is Qigong, Tai Chi, cultivation of energy, very mild. I think everybody needs to do that. I also have a pretty extensive fitness background. I've done that for many, many years. A sure way to injure yourself, where in Eastern medicine, you actually build internal strength in order to have an external strength. So it's from inside out versus the way we're used to do it in Western culture. Nutrition, eating with the season, also for your pattern. So you can't say, eat this or eat that. It's the same thing as with the herbs. You have to look at the patient and you have to tell the patient based on their pattern what will be appropriate nutrition for them. Warm foods, cold foods, spicy foods, all of that matters, because foods have taste and they have affinity. They also go to a particular meridian, or they go up or they get down. Like peppermint goes up and heavy foods go down. Okay. Lately, because of all this new state that we're in, economy and COVID and crisis, I actually had people reach out to me who lost their space. Businesses are closing out and smaller offices are closing. I have a chiropractor with me in my office, and I have an amazing physical therapist who specializes in scoliosis and also Pilates type of physical therapy. So I have two new people. I am looking for a nutritionist. I just don't have time to do all that. So we are growing into a much bigger multi-specialty, like a real deal one-stop health and wellness facility.
And you're not a businesswoman. Come on. You're hustling even during the pandemic.
I mean, you said that. I am definitely a hustler because I have a goal and I'm just gonna do whatever it takes to get there. And maybe it's part of me being an immigrant. You know, we come and I love this country. This is an American dream. We go from having nothing to having all this. My sister's an amazing physician. She's like #1 breast surgeon. Why not? Who's there to stop me? So yeah, I think if you hustle, you'll get there. It's just the matter of persistence and the will and desire and not giving up.
That's I mean, that's fantastic advice and very true. And it's nice to see the American dream, take, so again, I'm a believer in what you do and all the stuff that you mentioned, but there are still haters out there, even if there's buy-in and media's into it and it's trend. So what do you do in an initial consultation with patient X who, has been told by their physician to come see you to seek out Eastern medicine or alternative medicine, and they're not buying into it? What's the trick? How do you get them to buy into it aside from seeing the results?
It's a really good question, because when I was younger, I had a lot more of that. Now I think my attitude does not allow for this. It's just like when I come into the treatment room, it's my treatment room and I dictate. Even if you don't really believe in it, you're going to feel it. And there is scientific evidence. There are studies all over the place. And if you have questions about specific condition, maybe it's not curable, but there is definitely evidence all over the place that it works. And same thing as with Western medicine, there are no promises. Some people respond better, some people respond worse. And it's a cumulative effect. So it takes a patient being committed to their treatment and a great practitioner. I just pointed at me, a great practitioner. How did I do that? Who meets the patient at where they are. It's like I can't give them more than they can handle, but at the same time, we come to a synergistic relationship and I teach them absolutely everything about each meridian, each point, its function, its indication, what they can expect to feel, how soon they can expect to feel. I see it work practically all the time. It's just a matter of when. Commit, like with exercise. If you go to the gym once a month, once a week, you see some results. If you do it every day, every other day, you're gonna get there very quickly. So this is how that medicine works. I've had lawyers lay like this. Okay, I don't believe in it, but let's just see what it's gonna do. This is my last resort. And after 2 months, they get better, and that's it. They get a great review.
Yeah. how about fear-based? Like, you know, people who haven't been, you know, touched by needles before. I mean, again, there you have buy-in, you have someone, it might be their last hope, but they're still fearful of, you know, whatever it is that you're doing.
Yeah,
How do
that
you handle
this is a really big one because as Western patients are taught to be delicate and sensitive and they don't want to feel pain or will it hurt? I get this question all the time, all the time. Not my favorite thing because I've been to China and I've seen how they needle intense, really intense, great results because you do want to change your patient. You don't want them to leave you the way they came in. So you want to produce enough effect so that when they get off your treatment table, they're like, wow, something definitely happened. So I explain what they can feel, and we have different ways. You have medical acupuncture, which is very intense, but you have also like an esoteric acupuncture, Japanese acupuncture, super thin needles, no manipulation, and maybe you start with that. We meet, like I said, patients where they are. Some people feel when you touch them, they will feel if they're a little bit more anxious, they are super sensitive. And people who are a little bit more depressed, you can do anything, they won't feel it. So we really play, you know, like I would palpate, I would go with the flow. I talk to them, how does this feel? How does that feel? No problem, we'll go a little bit stronger. Definitely fear is a big one. And like with medicine, oh, the herbs, how do they taste? Pretty bad. They taste really bad. But so what? The fact that we have Tylenol that's pink and sweet, it's actually another layer of toxins on that Tylenol.
Yeah.
So yeah.
Well,
I give them the real deal. I really don't sugarcoat it. And I think most people know me for that. I tell you the truth. I tell you what to expect. And I will also tell you that it's only to get you better. I sometimes tell them I do it with love. Just know that I love you. I think it helps.
and I've been to your offices. I mean, all the stuff is comfortable, and it's a very zen environment. So I mean, I think that's one step because it's spa-like. So I think that, you know, draws down some defenses. But you know, there's definitely real fear and, you know, and anxiety with, you know, with something new and with, you know, needles. I remember being a kid and being afraid of getting a shot, and I need my
Yeah.
money.
Yeah,
But
this is, I think, how people developed fear of needles. It's from being a kid and being terrorized by immunization, even though I'm not against it. Like, I think there is place for everything, but my son is the same way. My son is 20 years old now, and for him to get acupuncture, it's the toughest thing ever. Because I remember holding him when he had to give blood. That's like it was yesterday, even though it was like 15 years ago.
yeah.
So yeah.
So I want to switch gears a little bit into you know, the pandemic. I know that pandemics affected you know, us globally and businesses everywhere. You know, where have you guys been as far as being essential, non-essential, and you know, and what's it been like, you know, March, April, early on, and now that it's, you know, we're kind of, you know, riding this new train. What's it been like now through this transition and time period?
Yeah, this is an excellent question. So my staff stayed home, everybody, because we were like in the gray zone. Are we essential? Are we not essential? And I applied to be an essential business because everybody closed. I have patients. I live in this neighborhood. So for me to go to the office and to help someone, I don't need to commute. I don't need to expose myself to anything. It's just like a short walk. I got an email back saying that, you know, if we did not stop you from working, consider yourself essential. And I went back to the office. Very few patients, mostly local people would come in, but there was so much need. People were panicking, right? People would have an anxiety or panic and think that they're having shortness of breath and burning in their chest because it's COVID. So I felt a huge need to be there for them. And people are exercising like crazy now out on the street, hurting themselves too, and they have nowhere to go. So the space that I have right now is pretty big. So there is no way people are facing each other. There is no traffic at all. Nobody ever waits. In my clinic, there is no wait. You come in, I respect your time, you go straight into the treatment room. So for sure. And we give you at least an hour. We do everything possible in the shortest amount of time. So very slow, but I treated patients, I cleaned the tables, I ordered supplies, I restocked, I took out the trash because there is no help from the building either. We are picking up. Maybe last month I brought a few employees back, people who did admin the work from home, but of course acupuncturists had to just relax, enjoy the stay while we were doing our COVID thing. Disaster. traumatized me too. But now it's picking up. People are coming back, but I would say New York City is struggling because most people like yourself are not in New York anymore. So we kind of working for a different crowd. We used to be servicing mostly commercial companies, a lot of people who come to work. Now it's mostly people who live here, I would say for now.
I mean, and is it hard for you because, especially as someone who's a healer and you're doing this altruistically, throughout your mission and time doing this, you have these amazing assets, you have yourself, you have the locations, but you have patients who need you more than anything, but they're scared to come in, or you don't know, or just not, or people moved away. That's got to be frustrating as can be.
It is frustrating, and I'm in a place where I'm wondering what would be the best way for us to go, because I'm thinking, because most of my locations were in New York City because there was such a demand. People don't travel, by the way, in New York City. It's like 10-minute walk and then they come see you because everybody's super busy. I don't see the need to be in Manhattan, so I sort of planned on possibly doing the Westchester, the Long Island, and Florida. I would love. I just had a meeting with somebody in Florida because people are moving. People are moving to different places. New York is not a nice place to be at. I love the city. I feel sad. I don't know what's going on and how we can recover, but for sure, instead of being all in one place, I think we're going to have to spread ourselves. And maybe Moscow.
All right, cool.
Moscow.
I'll get there too. I'll get there. Yeah, I mean, it's crazy because, like, to me, the healing that you can do, and the stress relief, and when the hospital system and medical system is overburdened, you guys should be a relief of that, or at least an alternative to it.
I will also say that people are waiting to get sick, and if you look at what we do, it's probably the most ideal thing is to come to us, any one of us, because we can identify the weakness in the body, in the organ system before you fall ill. Because when I put my hands on your pulse and I look at your tongue, I can identify weaknesses and imbalances before they even become a problem. Because the issue, the disease doesn't start on the physical level. It starts on the energetic level. I mean, on the consciousness level, then energetic level, and then it appears on the physical level. So you don't have to be sick. We can prevent this from happening. And there is a Chinese saying that a good doctor, when the doctor takes care of the patient just doesn't get sick. And if the patient does get sick, then you have to pay the doctor. The doctor has to pay back to the patient. It's bad medicine. You don't want to wait till things are bad. So if you start coming in now, when everything is functioning, we can work on your lungs, we can work on your circulation. There is so much we can do before there is an issue. So I think we should be the first line of defense. And then when things really get bad and we are not enough, then you go to Western modalities because they're much stronger. Right now it's the other way around. They go through super invasive things and then they come to us because it's chaos, too many side effects, where you should do Chinese medicine, alternative medicine, nutrition, meditation, and then if it's necessary, do something more aggressive. But we are definitely, I think, we are super essential.
Yeah, I mean, we are a country where we over-medicate and we, over-operate, and, there's lots of things, and, preventative is not, our standard of care.
It is changing, though, slowly but surely it's changing. And I think through this chaos that we are in right now, it's probably going to change even more. We can't sustain this lifestyle. We cannot be toxic to ourselves. We cannot be toxic to our planet. It just won't last. It's going to collapse. So you have to eat better and you have to treat yourself better. So I think this year is such a difficult year for everything. Then I think for our medicine, it's actually going to come up, because I do have patients asking me for help that I never thought they would. Young generation, especially.
We just got a question from Shayna, who's one of my viewers and my friend, but first my mother-in-law's friend. She asked, Shayna, thanks for watching. Thanks for the question. She said she's wondering if acupuncture is covered by insurance.
It is covered by insurances, and most of my business is based on insurances, but not all of them. The big companies that can afford to buy a great policy, they include that coverage. Smaller companies I haven't seen. We do absolute best to make your insurance pay for our services. Like, I try everything possible, and I have a billing staff because I know it's hard. It's much easier for me to tell you, come to me 10 times when you have insurance and we will work with your insurance, versus telling a patient to pay me out of pocket. I feel for the patients. I've been a patient many, many times, and it's very difficult to go to a doctor and having
What
this
about
mental
what
strain.
about Medicare or Medicaid?
Medicare, I believe just last year, maybe even this year, they agreed to pay for acupuncture, but it's only for one condition, only for lower back pain. I don't know exactly when it's going to take hold, but I will also say that the reimbursements when you go through Medicare and Medicaid are so small, it makes it very difficult for practitioners to do a super good job because you have to see more patients to be able to handle the overhead. Yeah, but it's coming along. It's changing.
All right. So again, buy-in's coming along. You were ahead of the curve, and you're getting there. You're meeting each other. Exactly. And now the spike graph. So, I mean, we're called the brick wall because it's about facing your challenges, like what's on the other side of the wall, how you're going to get there. What's been your biggest challenge during the pandemic, personally and business-wise, that you had to overcome?
I wish I could say fear, but I don't think I have any fear. It just doesn't exist in my book. I'm just my biggest challenge, I miss my staff. I've been building this company for so many years. It took me 15 years and I finally had 15 people and it was so amazing and a great new office. And then it all collapsed. For me, it was humbling that it was just taken away from me. So to accept that as, okay, no problem. We're going to figure this one out. We're going to rebuild. We're going to make it. It took me 3 days. It took me 3 days to put myself back together and go back to my office because I think we are essential. We can help. And what I'm in for, what I do this for is the right reason. So if I'm doing it for the right reason, people will see, people will come back, and they are coming back, which is pretty amazing. And I also, most of my staff, the acupuncturists who are so talented, they have something else going on. They all have something else going on. So I'm always there to help. I always say, like, I'll teach you everything I know. Brick wall, there is always a brick wall. There is a wall after wall after wall. And it's like life thing, right? You break one, there is another one. You break one, there is another one. It's great. You embrace it. The more brick walls, the better the success tastes.
Well, yeah, because you get that relief from plowing through, and yeah, I always say you close that sale, you get that news story, you deliver that product or deliverable. Yeah, it definitely tastes better when you're challenged and have to get through it.
Yeah. So I like the idea of.
So one more question from Shannon. She said, do you serve a geriatric demographic, or are they less likely to seek alternative medicine?
They are very likely to seek. I've had a lot of people reach out. The problem is that they don't have the benefits and most of them can't afford it. So I've been always saying that I'd rather volunteer. I'm more than happy to set up a day where I volunteer and I offer help to people who can't afford it, rather than be accepting very low pay like Medicaid. I would rather give my services for free because out of my goodness of my heart than have insurance tell me that my worth is so small. So if you need acupuncture, hi. And location, of course, because most of my business is in Manhattan. It wasn't really residential. So, but new plan, because I'm thinking how much Manhattan needs me, probably not that much at this point. I think we are going to go into residential area and geriatrics in great need because my mom needs me. My mom is always pain here, everywhere. And who's going to be there to help? It's usually up to us because we have no side effects. That's the biggest plus. Acupuncture has no side effects. The worst case scenario, you end up with a little bruise.
And so, to me, a really important question. I was talking to you earlier before we, went live. I'm dealing with, my New York landlord. I'm dealing with this business issue as a business owner. Even if you're super zen and you're, about health and wellness, you're always dealing with, bullshit, for lack of a better term. Lots of brick walls and challenges. How do you stay zen? I mean, again, I don't necessarily stay zen. I'm trying to, learn and meditate and do things to do that, but I still, shoulder my way through the brick wall and, don't gently take the bricks apart. But how do you, as someone who promotes health and wellness, and, a Zen lifestyle and natural healing, how do you maintain that when faced with a great challenge or bullshit that we talk about?
I have a luxury of getting on the table of one of my providers and I say, okay, okay, I need some peace and quiet. So they treat me, but I also try to look at everything like you probably know or you don't know. I like Kabbalah. I like this higher explanation to a Bible, and you can look at everything from a different perspective. And the landlords are difficult. They are difficult. They did not budge in my office. My residential landlord actually gave me a break, but the office is not so much. But generally speaking, if you, I don't know, pray, meditate, whatever works for you, on them coming to their senses, it works. So
Let
don't do
my
it for
people
you.
go. Let my
Pray that they're gonna come to their senses, and it will happen. They have no choice. People are leaving. It is definitely frustrating, but if it's a free country, okay? We get up and we go. That's it. So,
Absolutely.
you're welcome to come to us too. You'll feel much better. And actually, if you meditate, you get clear mind and the better ideas come. Because when you're in this reactive mode, it's nonsense. It's your ego fighting. You don't do the right thing. So if you calm down after acupuncture, for example, you might get a brilliant idea that will help you, because it's all the art of negotiation, right? They want you there. They will lower your rent, because if it's not you, they're not getting anybody else.
Not right now, they're not. And so you're saying that it's bad to get into that fight or flight, hide in alert mode, because then you're just reacting.
Nonsense, complete nonsense. Yes, reactive behavior only going to bring another issue, another problem, and keep putting you lower and lower into darkness. Yeah.
If I really embrace this, I'm going to change the name from the brick wall to pillow talk. But I like that brick wall.
You should talk to my children. I'm not always zen.
All right, fine. Okay, that's a different conversation for a different time. But I appreciate you admitting that and saying that.
Yeah, I lose it sometimes.
For sure. No, but it's good to remain calm and in control. Before we depart, tell everyone where you can find Advanced Holistic Centers, where you can be found for a booking, appointment, et cetera, et cetera.
Absolutely. The main location is at 65 Broadway in New York City. It's cornered with Wall Street. It's in the landmark of American Express, the famous building. And 212-379-6414 is the phone number. You can call it or text it. We're all high tech. You can email admin at Irina Logman at .com, pardon. And advancedholisticcenter.com is the website, and it's filled with new information. It's actually a brand new website. Let me know what you think, whether you like it or not. I actually had an Israeli team do it for me. Okay, awesome. Straight from Tel Aviv. It has buttons everywhere where you can click on the button, and it will give you a whole list of different services we provide, from massage to acupuncture to physical therapy. And easy, press a button and the appointment will be made for you, or you can call us or get my number from this young man.
I really thank you so much for joining me. Thanks for being the 55th episode and for on your day off, joining me. I look forward to seeing you in New York, and I certainly in my negotiations with the landlord will probably need some needles.
Yeah, thank you for having me. It was fun. Was it fun? It was always a pleasure. Thank you.
Thank you so much. Talk to you soon. Bye-bye.
Bye.